Dear friends, commanders, my dear beloved students, hi folks, young colleagues. So today's topic, my opinion, is very important, extremely important for the student because in several months, just few months, we will have a big exams, last exams, no final exams, okay? So this video is not for good students or excellent students. This video maybe it's for lazy ones, for the lazy ones. So how answer questions exam? So for example, you have you remember nothing. You remember nothing from the topic. So you open the ticket, and in the ticket you have some questions. For example, it might be so-called test questions. So test questions are the questions where we have options, A, B, C, D. Which one is the correct? Or you are just preparing, and a few days missing. In few days you will have an exam, and you haven't prepared, or even you forgot something. So I give you several examples, just 3 questions how to answer, and once again figure out that you know nothing or you forgot something. So one is life hack from me to you, my beloved students. Just remember, in any question there is an answer. So there is no question without answer, and any answer is in the question, especially if there are tests or clinical cases. Just remember, in your life, every question got an answer. An answer is cached in the question. Okay? So, okay, let's start. Abdominal aortic aneurysms. And the question is, be careful now. Take pens, papers if you want, and just be careful. And let's go together. Question is, which of the following is the most common cause of abdominal aortic aneurysms? I repeat. So which of the following, now we will hear the following, is the most common cause of abdominal aortic aneurysms? Don't panic. Don't panic. First time you see what is abdominal aortic aneurysm. No idea. Okay, but let's read once again the question. So which of the following, so we will hear the following, and we understand that all the followings are the causes of the aneurysms, right? Once again, I repeat it. Every question got an answer. So which of the following is the most common cause of abdominal aortic aneurysms? No, now normally there are 4 options to answer for the tests. You've got this ticket. You have to time to prepare, of course, for exams, or just several days missing for exams. So let's go. Abdominal aortic aneurysm. If it's an aorta, of course it's an artery, right? It's an artery. So we have aneurysm. We remember something that this is something like ballooning of aneurysms. And what is the cause? Now we will learn. We will learn it from the question. Don't be surprised, even if you forgot everything. Let's look it up. Option A, post-surgical anastomotic disruption. So, okay, for example, me, I've seen these cases, of just few in my life, just few, maybe 1, 2. Of course, I am not a surgeon, but anyway, post-surgical anastomotic disruption. Now we know that post-surgical anastomotic disruption is one of the causes of abdominal aortic aneurysm. You get it? Do you follow me or not? You with me? Okay. So post-surgical anastomotic disruption, we know it from the question, is the cause of abdominal aortic aneurysm. Next, cystic medial necrosis. Cystic medial necrosis is not everyday situation, of course, but it's also one of the causes of abdominal aortic aneurysms. No, okay, of course, if the tests are correct. I take these tests from MSD, of course, Merck Sharp and Dome. Merck Sharp and Dome, no doubt. Always very good questions. So, now we know that post-surgical anastomotic disruption and cystic medial necrosis, it can be the cause of abdominal aortic aneurysm. If professor said, can you answer this question? If it's oral. You can talk a lot about this. For example, you can answer that abdominal aortic aneurysms got several causes. One of them, post-surgical anastomotic disruption. You know it from the question, from the test. Cystic medial necrosis. But the question is, be careful, very careful. Which of the following is the most common cause? Not just cause. Another option is vasculitis. Okay, vasculitis, no, we know that it's autoimmune disorder. Of course, now this is an area of autoimmune disorders, autoimmune diseases, but of course autoimmune disorders is not everyday topic, it's not everyday case. And of course vasculitis is most common, without any doubt, than cystic medial necrosis or post-surgical anastomotic disruption. You follow me? So now we know three causes of abdominal aortic aneurysms. And finally, the last option is atherosclerosis. Atherosclerosis got everybody after 30, 40 years. 40, don't talk about 40 plus. So, of course, atherosclerosis is the most common cause of abdominal aortic aneurysms. And now you've got the answer. Because we know that atherosclerosis is everyday condition, is everyday issue. And doesn't matter what narrow specialty you will choose in your future medical life. So you've got answer. Just listening and being careful in reading in exams question. Now we've got answer, and we can answer in this manner. Dear professor, abdominal aortic aneurysms can be caused by post-surgical anastomotic disruption, cystic medial necrosis, vasculitis, but most common cause, of course, is atherosclerosis. Now you learn a lot of things from the question. Once again, every question got an answer. Okay? So next, what is this? As next. Yes, open please. Abdominal ultrasound, also about abdominal aortic aneurysms. And the question is, abdominal ultrasonography or computer tomography is usually the test of choice for abdominal aortic aneurysm, but which imaging test be most appropriate for hemodynamically unstable patients? So I repeat the question, my dear friends, and let's go together. Just follow me. Be very careful. So abdominal ultrasonography or tomography is usually the test of choice for abdominal aortic aneurysm. Now we know that for revealing abdominal aortic aneurysm, we need a visualization technique like abdominal ultrasonography or computer tomography. Now we learn it. Which from? Where from? From the question. Now we know that abdominal ultrasonography and tomography are test of choices. So be careful. What does it mean, test of choice? Means there is no better options. This is the best option. Test of choice means the best option. In my time we said gold standard. Gold standard. So the best. Test of choice means the best test. Or test of treatment means the best treatment. Gold standard treatment. Here is a test of choice. And we know that for detecting aortic aneurysm, we need imaging techniques like abdominal ultrasonography, the routine ultrasonography or tomography. But the question is, continue. Which imaging test might be, right? Yeah, might be, no, maybe most appropriate. Right place, right time. For hemodynamically unstable patients. Now we have to understand what does it mean hemodynamically. When we talk about hemodynamic, especially in cardiology, no, it's hemodynamic, it's cardiology. Means we have the problem with or blood pressure or heart rate variability. So of course patients that are unstable have changing of their blood pressure, or might be rising of blood pressure, maybe dropping of blood pressure. And these patients are unstable. Of course, this patient unstable, what does it mean? Unstable? Unstable means unpredictable. So we can't predict. And of course, the patients that are unstable are very, very dangerous, because nobody knows what will happen in several minutes. Just God knows. So we know from the question that in abdominal aortic aneurysm might be situations that are very hemodynamically unstable. So with hemodynamically unstable, we understand that elevation of blood pressure might provoke disruption of abdominal aortic aneurysms, and it's a death. It's life-threatening condition, right? So, and we know actually from the question that for visualization, for revealing abdominal aortic aneurysm, we need a visualization technique. Which one? Options: computer tomography. From the question, we know this is one of the options, test of choice, but we talk about hemodynamically unstable patients. So send patient from emergency, from intensive care units to department of computer tomography. It's highly risky. It's risky. Why? Because nobody knows what will happen on the way to computer tomography or just in computer tomography theater. Nobody knows. Because we have hemodynamically unstable patients. It's not a stable patients. Once again, we know it from the question. Next option, magnetic resonance angiography. The same history. There are always lines for magnetic resonance angiography and computer tomography. Okay, might be it's emergency, everything okay. But anyway, you take the patients from emergency and send them to computer tomography or MRA department. It takes time. It's highly risky. Plain abdominal X-ray. What for? What for? And finally, next question is abdominal ultrasonography. And definitely, abdominal ultrasonography is a test of choice for hemodynamically unstable patients. Because we can take it, this gadget, this device is not big device, it's like a little luggage case, like little case, and go to the bed of the patients and just check up his abdominal presence or absence, his abdominal aortic aneurysms just at his bed. And of course, correct answer is abdominal ultrasonography. So finally, for hemodynamically unstable patients with presumed rupture, ultrasonography provides bedside results more rapid, no questions about that, more rapidly than computer tomography. Of course, my beloved friends, interstitial gas and distension may limit its accuracy. But anyway, we have hemodynamically unstable patients. All that we've got from the question. And of course, we can understand that if rupture is not suspected, magnetic resonance angiography, MRA, or computer angiography, of course, can more precisely characterize aneurysm size and anatomy. We know all that. But in patients, they are without risk. They are stable. If rupture is not suspected. How I know that? From the question. In any question, we have the answer. No, plain abdominal X-ray are neither sensitive nor specific. However, if they are obtained for other purposes, they may show aortic calcification outlining an aneurysm. No, it's not serious. Okay, and finally, one else, my dear friends. So, which of the following is not an indication for surgical repair for abdominal aortic aneurysm? So, it's not a indication. So, abdominal pain. Abdominal might be not an indication. Of course, it's an indication. Increasing in an aneurysm size. So, if you've got a pain, it's emergency. Might be rupture of aneurysm. Definitely. Easy peasy. Increasing in aneurysm size by 0.5 centimeters within 6 months or by 5 to 10% a year. Of course, all these are indications. And finally, aneurysm small than 5 centimeters without pain. Aneurysm less than 5 centimeter, actually it's a highly, very questionable. It's highly likely not aneurysms at all. Anyway, if we have something that not increases, it's just a logic. You don't need for surgical repair. Just take for episcoposis, for monitoring these patients. So we know that repair of aneurysms less than 5 centimeter doesn't appear to increase survival. How we know that? From the question. So largely sufficient for this. Now what I want to say that if you are lazy, use your brain during exams or just for preparing for these exams. Okay? And you will be successful. You see? Now we answered 3 questions, even knowing nothing about aneurysms. We learn all this during reading the questions. So God bless you during these exams. Everything will be okay. I love you all. Bye-bye. Don't forget to follow and subscribe my YouTube channel, huh?